So good evening, everyone. Welcome to Maa-Si Care Clinic's Q&A session on breastfeeding. So myself, Dr. Tanima Singhal, and I welcome you all. So you can put your questions in the chat box. I'll take first questions which you have filled in the Google form, and then I'll take the live questions. So you can put your questions in the chat box. Till then, I'll start the questions which you have filled in the form. The first question is from Priyanka, low milk supply. So Priyanka, if you are facing low milk supply, then you need to do few things. So number one is you need to create demand to get the supply. So if your baby is not at all latching on the breast, you need to start pumping. If your baby is already latching on the breast, but you feel the supply is less, then you need to do it frequently and you have to pump after feeding the baby. And along with that, take 3 liters of water every day, do oil massage and warm compress, and take galactocox like lactomagic powder and Morico tablets. Along with that, keep checking the baby's weight gain. All these things are important to know to work on your milk supply. Next question is from Payal, latching. So, Payal, if you are facing any issues with the latch, then you need to first understand the correct hold and correct positions of latching. So, while you are bringing the baby on the breast, you should hold the breast in a way so that the baby can open a big wide mouth to have a big latch. So that will help the baby to latch on a bigger part. Don't worry if the nipples are flat or inverted. So latching has got no relationship with that. You just need to work on the technique. So the correct technique for latching is the cross cradle hold. You can find a lot of videos on YouTube. So that will help you to work on your latch. Next question is from Lakshmi. Low milk supply and baby is feeding is not well. So if you're facing low milk supply, I've already answered. Baby feeding is not well, maybe because of low milk supply. So start it for like it will help to improve your milk supply, and the baby will also help will latch properly and will feed well. Next question is from Seema. After breastfeeding and pumping, when I will be able to feed again means by when I will be able to produce enough milk to feed my 2-month-old baby, because 10-15 minutes he starts crying. If I try to feed after 2 hours, also I have started the treatment. So Seema, because right now you are saying that when will I produce enough? So I don't know how much milk you are producing for now and how many times you are pumping. Since you have already taken the consultations from my team, so the team will keep telling you about all these things. You can just connect to the team. And suppose if you have specific questions, then you can ask me in this webinar. Next question is from Shelja Mishra, 1.5-month-old baby. So what is the question, Shelja? The question is not clear. Basanti, low free breastfeed. So for low milk supply, I have already answered just now. Bhuvana Rani, breastfeeding positions. So the most common hold which we want the mothers to try is cross cradle hold. Second is cradle hold. Third is what is called as football hold. And fourth is sideline hold. Along with that, there is a hold called as laid back feeding. All these are the different positions for breastfeeding. Next question is from Sakshi. My baby is not latching since birth. He cries a lot, and due to this, my milk supply is zero. What should I do now? Now I also worried about it. Since your baby is not latching since birth and the milk supply is zero, then I would suggest Sakshi, don't wait on any tips and tricks, because our baby is growing very fast. We can't wait for the things to settle on their own. Just reach out to the team tomorrow and get your consultation done as soon as possible. Next question is from Asya. Baby is totally rejecting breast. So is it because we don't have enough milk, or is milk is there but baby is rejecting the breast? First of all, I am not clear about this, Asya. So just make your question clear. Next question is from Supriya. Preparing to join office when my baby will be 5 months old. How should I manage? So what you need to do, suppose your office timings are from 9 to 6. Then during those times, whatever are your baby's feeding sessions, that time you can pump during your office hours. Rest of the times you can feed the baby, and the express breast milk, which you will be pumping in the office, you can replace it at the home next day. And also because after 6 months, baby will be starting solids also. And since if you have time for now to join the office, start pumping from now. Next question is Kiran. Kiran says, I want to understand exclusive pumping and stash making schedule to get started for a 6-month-old. So what you need to do, first of all, see what is the demand of the baby. Accordingly, you start pumping and follow the other things which I just mentioned. Once you start seeing that the milk is remaining and the baby is not finishing up, then you start storing it in the fridge. So what you do, you keep a small container and keep pouring the milk in that same container for the same day. And in the night, just close it, mark it with a put it on a paper, put a paper on that on the front, and stick it and write the date of it and keep it in the in the freezer. So that way you will be able to create a stash for you. Next question is from Nikita Verma. My baby is 20 days old. My nipple is flat, but by injection and breast pump, it makes he is directly sometimes taking my nipple and sometimes he refuses. I have to give him milk by taking through the breast pump. Okay, so Nikita, your baby is just 20 days old, so just practice the proper methods. And because less than a month baby, we are too busy with the baby. So if your baby is not latching, this is the right time. Just reach out to the latch expert in the team. She will help you with the latch, because as the baby will grow, the baby will get used to the bottle and then the baby will not latch on the breast properly. Next question is from Chandu. My baby is not like to breastfeed, only prefers bottle feeding. So if the baby is preferring bottle feeding, well, just make sure that the milk should not drop by itself. Have a slow paced bottle. And whenever you're feeding the baby, just make sure that just try every time. If the baby is not coming on the breast, then you can give bottle. But I advise you to try every time. Suppose you make 8 to 10 attempts and the baby starts feeding 1 or 2 times, so you will gain confidence and then you can scale it on that. Next question is from Ume Hami. Is my baby getting enough milk? So if you are not sure whether your baby is getting enough milk, you need to keep a track of baby's weight. So for a baby less than 3 months, the baby should gain 150 to 200 grams per week. From 3 to 4.5 months, baby should gain 150 to 100 grams per week. From 4.5 to 6 months, baby should gain 100 grams per week. So Ume, if your baby is gaining this weight, then your baby is getting enough milk. So these are the questions from the Google form. Now let me see what, if any question are there in the chat box. Yes. So first question is from Sri Vidya. When I pump, milk is less, but when a hand express, milk is coming, what to do? So what you do, you just pump for 10 minutes and do hand expressions. What happens, what also you can do when you're pumping the breast, after some time, like after 5 minutes, just change the position of the pump. It means by hand expression, you are able to empty from the different quadrants of the breast, which is not getting emptied by the pump. So just make sure to change the position of the pump. That will help you to get more milk with the pump. नेक्स्ट क्वेश्चन इज वर्षा मैम, ये सब ट्रीटमेंट कितने दिन करेंगे तो मिल्क सप्लाई इंक्रीज होगा? आपको अभी आपका मिल्क सप्लाई कितना है? अगर आपका मिल्क सप्लाई मतलब अगर आप बच्चे को फॉर्मूला 4 बार से ज्यादा दे रहे हो तो आपका ये 20 से 25 डेज में ट्रीटमेंट कंप्लीट हो जाएगा। अगर आप बच्चे को फॉर्मूला 4 बार से लेके कम से कम 8 बार दे रहे हो तो आपको करीब से 1.5 से 1.25 महीना लग सकता है। अगर आप 8 बार से ज्यादा फॉर्मूला दे रहे हो तो उससे ज्यादा टाइम भी लग सकता है। लेकिन ये रिजल्ट्स एक हम एवरेज पे बता रहे हैं। कई मदर्स को इससे जल्दी भी रिजल्ट्स आते हैं, कई मदर्स को इससे देर में भी आते हैं, क्योंकि हर मदर डिफरेंट है, हर बच्चा डिफरेंट है। हम ट्रीटमेंट प्लान जब देते हैं तो मदर्स के अकॉर्डिंगली देते हैं। रिजल्ट्स जिस तरह से आते हैं उस हिसाब से हम मेडिसिन की डोजेस को बदलते हैं। Nikita Verma. Madam, I am having my 20 days old baby. He's not taking my nipple. Somehow taken, somehow not take, but with breast shield, he's taking it. And I am having flat nipple. I think he's not taking it properly because my properly by breast pump, I have to give sometimes formula milk. So Nikita, if you are having flat nipples, then hold the breast in U shape from below and bring the baby from the other breast on the other hand. So this is called as cross cradle hold. If you try in a cross cradle hold by holding the breast and pressing the breast, the areola will be pouted and the baby will be able to latch from the areola. That way you will get a lot of help. So if your baby is 20 days old, that's what I was suggesting. You have put that question in the chat in the Google form also. So I would suggest you to reach out to the latch expert. She will help you to how to latch the baby. That way you will be able to resolve your latching issues. So tomorrow contact the team. They will help you with the latch expert call. Next question is from Soumya Girish. Where to buy Moringa tablets? So drmix.in is the website. If you just type on Google DRMIX, drmix.in, then you will go on the website. There you will find Lactomagic powder, Moringa tablets. It is also available on Amazon. So you can order from there also. The name is Morico tablets. It is not Murunga, it is Morico. Morico, Morico. Morico tablets, and Lacto Magic powder. नेक्स्ट क्वेश्चन इज फ्रॉम वर्षा. मिल्क सप्लाई जीरो है. अगर मिल्क सप्लाई जीरो है वर्षा, तो अब आप टाइम वेस्ट मत करिए, कल ही टीम को पहुंच करके मिल्क अपना कंसल्टेशन लगवाइए और फटाफट ट्रीटमेंट स्टार्ट करिए. सुमति, ma'am, electric or manual pump for increasing milk supply. So the only difference between electric and manual pump is in manual pump you have to make the efforts with the hand, but the electric it is done by a motor. So this is the only difference. Otherwise, because you are all are new mothers who have recently gone through like delivery process, so the hand expressions become or hand pumping makes it tiring. So then you can go for a electric breast pump. Next question is from Soumya Girish. How to get to know breast empty? So what you do after every breastfeeding session, you press the breast and see the color of the milk. If the color of the milk looks thick white, that means breast is not empty. Either feed the baby from the same side or you pump the breast. Next question is from Ume Hani. Sometimes baby cluster feeds and my breast milk is empty. Will milk still come if she sucks? Yes. So what you do if the baby is cluster feeding, then you shift the baby to the other breast, and then after 10-15 minutes, if you put the baby back to the first breast, the milk will start coming. And if it is not coming, that means you are going through a supply issue. Then you can contact the team. They will help you to increase the milk supply. Sri Vidya, I am feeding 40 days old baby directly from the breast. First 20 minutes and then formula with 60 ml every feed. If I reduce the formula, he becomes very restless. What to do? So what you do, Sri Vidya, right now, whatever tips I have told you how to increase milk supply, follow that. And after every breastfeeding session, you just pump for 5 minutes. And slowly, once you keep doing it for every feeding session, you will start seeing milk with the pump also, or your baby will finish the milk from the pump. Oh, sorry, from the breast. Then you will see that once you are giving formula milk, when you're reducing the formula milk, the baby will also get settled with lesser amount of formula also. क्वेश्चन इज फ्रॉम वर्षा. मैम, मैंने ट्रीटमेंट स्टार्ट कर दिया है, 5 दिन हुए हैं, अभी पूरा बेबी काउ मिल्क पे है, मिल्क सप्लाई जीरो है. मैम, 1 मंथ में मिल्क सप्लाई हो जाएगा ना? हाँ, देखो अभी आपने ट्रीटमेंट अभी 5 ही दिन हुए हैं, तो अगर आपने प्रोग्राम 1 महीने वाला किया है तो उसमें अभी आपको 14 डेज के बाद कॉल होगी, उस पर हम डिस्कस करेंगे. अगर आपने हमारी और किसी टीम से किया है तो उसमें 7 डेज में आपको कॉन्टैक्ट करना होगा. बाकी आप प्रॉपरली सारी चीजें कर रहे हो कि नहीं? अगर आप सब चीजें कर रहे हो तो मिल्क सप्लाई आ जाएगा. पंप में शुरू में अगर आप रिलैक्टेशन में हो तो पंप में शुरू में मिल्क नहीं आएगा, हाथ से आएगा जब आप हैंड एक्सप्रेस करोगे. धीरे धीरे करके आपको सेकेंड वीक में पंप से भी मिल्क दिखने लग जाएगा. वर्षा. Okay, so I don't see any new questions. So I think that's all for today. If anybody of you have any new questions, you can put it in the chat box. Otherwise, we can end up this session today's. Sumati says, ma'am, only single stream. तो अगर सिंगल स्ट्रीम वाला है सुमति, तो if you have only single stream, then don't worry, you just need to do oil massage on the breast and warm compress and follow all the treatment protocols which I just shared. So just follow that and the milk supply will start increasing. You just follow for 4-5 days and see if the milk is not increasing, reach out to the team. They will help you with a consultation with the doctor, and accordingly you can have a consultation with the doctor and they will help you. So we have 3 other doctors in the team, including me. I am also there. So we have 4 people in the team. You can either have a call with me or with any of my trained doctors with that. नेक्स्ट वर्षा, 7 डेज का प्रोग्राम है मैम, तो 7 डेज में अभी कैसे रिजल्ट आएगा बेटा? आप 7 डेज पहले प्रॉपरली फॉलो करके वापस टीम के पास जाइए, वो आपको एक बार पूरा आपका देखेंगे 7 डेज का प्रोग्रेस, आपने कितनी बार किया है, सारी चीजें करी हैं, वो सब चीजें प्रॉपरली फॉलो करिए. एंड उसके बाद जब आप टीम को बताओगे प्रोग्रेस, उसके हिसाब से वो आपको आगे का प्लान देंगे. 1 महीने का प्रोग्राम वो आप टीम से कल बात कर लेना, वो आपको एक्सप्लेन कर देंगे. Umme honey, how long can we take lacto boost? So I don't prefer lacto boost because lacto boost के जो granules हैं, they have got preservatives added. So if you see the any kind of galactococcus which you are using, just check the back side of it. It has got preservatives added, which I don't want. So what I suggest is lacto magic powder and Morico tablets. This is what I suggest because they are 100% natural with no preservatives and no chemicals. The Ume which you are asking is lacto boost, which I don't recommend because it has got preservatives added. I prefer lacto magic powder and Morico tablets. Questions? If you all have any new questions, just let me know. Okay, wait. Hema Malini says, ma'am, my baby is preterm, 27 weeks gestation and delivered, now 3 weeks old. Tube feeding, giving in ICU, and I am taking Lactair tablets 3 times and Galact granules powder I am taking. Still, my milk supply is low. What to do? See, I don't prefer using Galact and Lactair. I'll show you why. So I'm just sharing the screen so that I can show you something. Why it is not recommended. Wait. I'll show you it. So this is Google and you just type Galact. If you open the images and see the composition of this powder, you will be having it yourself also. Just check it. It has got preservatives like sodium methyl parabens and sodium propyl parabens. So parabens are not safe. They are not used even in paraben-free shampoos, paraben-free creams we are using for kids. It is not safe to be taken by the mother to increase the milk supply, especially right now your baby is preterm. And also if you see this one, Lactair, this one. Even if you see this, even see this one. It has got sodium propyl parabens, sodium benzoate, and methyl parabens, which are not good for human consumption. They are not good for anybody's health. And especially for a preterm baby, I would not recommend. So what I suggest is, I'll just show you that also. Lactomagic powder, this one. This is what I suggest. It is available on, if you type on Amazon or Google, you will get all these links. You can order from anywhere where you want. And other one is Morico tablets. This is Morico tablets. You can order it wherever you want. So first 2, 3 images are Morico. You can order it from wherever you want. So this is the Morico tablets. There is one more new packing also they have changed. So you can just see whatever is available. And otherwise you can go on the Dr. Mix website. drmix.in. This is the website. You can see these products are there. Rico tablets. This is the Lactomagic powder, and this is the massage oil for massaging on the breast to improve your flow of the breast. These 3 things are there. You can also see the combos are there. You can buy it as a combo, as 90 days, 30 days pack, 15 days pack. A lot of things are available. You can go on this website also. You can take the discount code also. Okay. Honey. Right now I'm using Helo 5 powder, which has Ayurvedic ingredients. Is it fine? That's what I was showing you. Just a minute. Let me share the screen again. Lacto. Take the back side of it because they have not shown the back side of it. You need to just check it. I think it has got preservatives, even this one. You need to check the back side of it and check if it has got preservatives added, because they have not shown the back side of the this lacto boost. You need to check the back side of it If it has got preservatives, then it is not safe. So preservatives like methyl parabens and this one, propyl parabens are not good. So Ume, just check it. You would be having the box with you. Just check the back side of it and let me know in the chat box. वर्षा, मुझे अभी हैंड एक्सप्रेस करना है या पंपिंग करनी है? आपको टीम ने जो बताया वो फॉलो करिए वर्षा। मुझे आपका ट्रीटमेंट प्लान नहीं पता है क्योंकि आपने टीम के साथ काम किया होगा। उन्होंने आपको जो भी बताया उसको फॉलो करिए। Shri Hasti ma'am, can I unmute and ask my doubts? You can put it on the chat box. If it is a big doubt, I will allow you to talk. Soumya, how long can we take Morico tablets? So these are 100% natural with no preservatives, no chemicals. You can take it as long as you want. वर्षा मैम, मेरी ट्रीटमेंट में शेड्यूल थोड़ा अप डाउन हो जाता है, उसकी वजह से मिल्क सप्लाई में कोई दिक्कत तो नहीं आएगी। टाइम का इशू है। आप जितना कर पा रहे हो पहले करके 7 दिन के बाद वापस टीम के पास पहुंचो, वो आपको गाइड करेंगे वर्षा इसमें। Hema Malini, can I try Lactobite biscuit to improve milk supply? How can a biscuit help you, Hema? So you take proper medicines, which I just showed you, Lactomagic and Morico, they are good. Soumya Gracious, Hilofy has preservatives, I checked. So that's why. So any preservatives like sodium propyl parabens, methyl parabens are not safe for human consumption. You can take, Ume is also saying it has got preservatives like sodium benzoate and sodium. Yes, so this Hilofy Lactoboost is not safe because it has got preservatives. So you need to follow any kind of galactogogues which don't have any preservatives. And the two things which I recommend is Lactomagic powder and Morico tablets. I'll type them in the chat box also so that you have the spelling also. Tomorrow's. Okay, that's all. Now, any new questions? Sumati, ma'am, night time I am feeding, but morning even after feeding he cries drinking formula. So you just need to pump your milk after direct feeding. That will improve the demand and also follow the other things like Lactomagic, Morico, water intake, massage and the compress, and also in weight gain. All these things you need to check. Soumya, how many tablets in a day? So I don't know what is your milk supply right now, Soumya. So a safe thing is to start it 2 times a day. And then as per your results, you can increase it to 3 times a day. Sri Hasti, hi ma'am, does the taste of milk change during periods as I got my periods back? So the taste of milk will not change, but during periods, your supply might go little down during periods because there is a loss of blood from your body. So the body will conserve the nutrition. So the supply might dip for 2-3 days, but once the periods are over, you will have your milk supply back. Second is how to increase quality of milk, increase baby's weight. So after every feeding session, just pump for 5-10 minutes. That will improve your overall milk supply, and follow the other methods specifically when I told you about the galactogogues and your nutrition. So that will help you to improve your nutrition and that will your milk production. Shara, hello ma'am, I am a first time mom. I am exclusively breastfeeding my 2.5-month-old baby. The problem is she is only drinking milk from my left breast and totally refusing the right side. When I examine my right nipple, it seems flat and not erected as left nipple. But when I hand express, milk flows from it. Sometimes my right underarm was painful as a result of milk engorgement. I'm really worried because my family members gave her additional formula to compensate her hunger. What I have to do? So you do one thing. If you're having this what you said, engorgement also. So on the right side, if the baby is not latching, you just pump that side. And also follow if you're feeling flat nipples, follow the cross cradle hold on the right side. That will help the baby to latch. And after baby is latching, you just pump that side. So that way you will be creating enough demand to get the milk supply up. And also, don't need to give formula milk later on. वर्षा मैम, मेरा बेबी मिल्क सप्लाई के बाद लैचिंग पे आ जाएगा या नहीं? बेबी 3 मंथ 18 डेज का है। 3.5 महीने के बच्चे को ब्रेस्ट पे ला सकते हैं, लेकिन अभी अपना ट्रीटमेंट प्लान ठीक से फॉलो करिए और टीम के साथ प्रॉपरली कनेक्टेड रहिए। Sumatli. Ma'am, he's 1 month, 13 days. He drinks 120 to 150 formula. Is it common? That's a very high amount of milk what he's taking. And all of you today understand very well, formula is very bad for your child. Formula is loaded with sugars. If you check the backside of formula milk, it has got such high amount of sugars, and sugar should not be given up to 2 years. But in the formula milk, they have put a lot of sugars. And also formula milk is synthetic milk. It is not cow milk, it is not buffalo milk, it is not animal milk, it is not human milk. It is all preservative laden synthetic milk. So please avoid giving formula milk to your child. For a month, 1 month, 13 days, 120 to 150 ml formula is a very, very high amount of formula milk, Sumati. Just immediately start working on your milk supply. It is a priority right now. It is an emergency right now. So just work on your milk supply. Reach out to the team tomorrow. The team will give you, will let you know how to consult the doctors. So we have 3 more doctors, and I am also in the panel. You can have a consultation with any of them and work on your milk supply. Sri Hasti, baby drinks only for 7 to max 10 minutes, ma'am. Is that okay? So if you're not giving any formula milk and the baby is gaining weight, then it is fine, Sri Hasti. And if you feel that you need to give formula milk to the baby also, then after every feeding session, just check the color of the milk. If the color of the milk looks thick white, then you pump for 5-10 minutes. Soumya, even my baby takes 120 ml per session. He's 1 month, 13 days. Oh, that's very, very high amount of formula loaded with sugars. That is synthetic milk which you are giving to your kids. Please, please start working on your breastfeeding. Take the consultation that is already there. Sumati, I am following protocol since already 2 days. Very good. All the best. Sumati, just follow everything for 7 days. Get back to the team. They'll help you in like improving your milk supply further. Follow everything properly. Don't miss any protocols, any pointers. Don't miss anything. And once you get your like once you are connected to the team, don't have any gaps in your treatment. Follow everything properly. Your milk supply will improve, and just get rid of that formula. It's not safe. It's not good. So that's all for today. I think I'm not seeing any new questions. Anything else? Thank you. Sumati says, okay, ma'am. Thank you. You're most welcome, my dear. And all the best for you, because you're following since 2 days. I really wish and hope that you get the best results. So just follow everything. Don't have any gaps in between, and just stay connected with the team. Varsha says, thank you so much, ma'am. You're most welcome. Thank you so much from Ume Honey. You're most welcome. Okay, so that's all for today, girls. So see you all next Friday again. Till then, bye-bye. Soumya, thank you very much. Soumya says you're most welcome. Soumya, start working on your breastfeeding. Your baby is also taking 120 to 130 ml. This is not good. Okay, start working on your milk supply. If you have not reached the team yet, just reach out to them tomorrow and get your consultation done so that you start on your breastfeeding fast. Okay. Varsha says, okay, ma'am, take care. Thank you so much, Varsha. And all of you also take very good care of yours. Okay, bye-bye. Take care. Good night. Take care.